Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Today our topic is how is stable angina diagnosed? But before I really start this, I would like to share this live video on Facebook. Okay. If you're up here, please give me a thumbs up and say hello to me. Hi Veronica, how are you? And Eric, nice to meet you guys. Then and I'm just trying to share on my Facebook screen of this. So we're gonna talk about how Western medicine, to diagnose, how to diagnose angina. And yeah, we're gonna talk about, according to angina symptoms, how Chinese medicine to diagnose it too, right? It's a little bit different depending on, because the diagnosis is for the purpose of treatment, right? The reason we want to diagnose, we want to treat it. If there is no diagnosis, then we can't treat it at all. You don't know how to treat it without diagnosis. So diagnosis is quite important, very, very important. With angina, most of the time you can look at the symptom. When you look at the symptom, you feel, okay, yeah, it is, suspect is this, it may be angina, so then you need to further do some tests to actually diagnose it properly. Okay, I have difficulty to actually share on my YouTube video today, right? But anyway, probably I'll try it again, and if I have no luck, then I just have to leave it and just quickly start the topic today. I can go into the page. Let's go to the page. Okay. All right. I'm very good. Thank you very much. And hi, happy day. How are you? On Instagram. All right. Oh, okay. I've got it. I think I've got it. Oh, it still doesn't show the share button. Well, it's so funny. What? I can't help it. That's okay. Can't do anything for it. Right. All right. Let's talk about how to diagnose. Now we know that the cause of angina is because the artery become narrows, and that causing the artery become narrows can be blood clot, can be high cholesterol, build up the plaque, right? The plaque can form from high cholesterol, fat, calcium, right? So then, because of the narrowing of the artery, and if you suffer from angina, which means your heart couldn't get enough oxygen, blood flow into your heart, then it'll come, the symptom present is chest pain, tightness, fullness, discomfort in the chest, and shortness of breath, and maybe nausea, fatigue, dizziness, and sweating, with cold, anxiety, right? So, and typically come with excessive exercise, physical exercise, and as well, it may be happen with emotional stress, right? That occur when the physical stress and emotional stress. Okay, in this two situations that normally trigger. Now, when you have all this information, you know, okay, that is quite sure that is actually angina, right? And it's a stable angina rather than unstable angina, all right? Then here's a problem. Can you look at this and the description of from the patient, then you just diagnose it, make a diagnosis? No, you can't. Yeah, you can't. So the medical history is important, but the next step is run some tests for to diagnose stable angina. The tests include electrocardiogram. What's electrocardiogram? It's ECG. We heard about a lot, right? It actually measures the electrical activity in your heart and evaluates your heart rhythm with them, right? So it actually checking your heartbeat. Check your heartbeat, and because you, this is the thing. If you do this, you know, there's a missing part in here. Okay, here's the missing part that I want to share with you. Right, you don't get angina all the time. You get it when it's emotional stress happen, when it's physical exercise, then trigger. Right. So which you run an ECG in the hospital for a few hours, nothing happened. Of course, because nothing trigger you. There is no pain. So you can't pick up anything. Normally, all my patients have been to there and they've done ECG, nothing. Then next, they make you hook up with ECG thing 24 hours. And they only give you 24 hours. In those 24 hours, you realize you have something hooked up, but uncomfortable, that you know, you're waiting something happen, but it doesn't. It never happened. Why? Because you're pretty calm, you're not going anywhere because you're waiting something, right? The elderly patient, they're doing nothing at home, so nothing would happen. So you're not going to pick up anything. So very rare that they pick up things from 24 hours and within 24 hours for electrocardiogram. Very rare, right? So further on, more accurate and pick up more things with what? Angiography. Angiography is a type of X-ray that allows your doctor to see your blood vessels and measure blood flow to your heart. This is the real one. Oh yes, that can be better to look at it. So it can look at your blood flow, even though you have no chest pain right now, you have no symptom now, but they can have a look on the nourishing artery. So it's more accurate. It can pick up more thing. It can actually go into and have a look on the artery. Oh, okay, the race of the artery pretty good going through the blood, but this one has been blocked. They can measure it. They can tell you how many percent of the artery been blocked. So that is easier. I mean, more accurate and more straightforward to pick up to help you diagnose. Okay. Now, another one, because we know that you hook up the electrocardiogram, right? And for 24 hours, or you're in the hospital, and it didn't have nothing happened, and they couldn't give you a proper diagnose, and that's so that is so common that happen. Then therefore, there's another one which do a further test. It's called stress test. What does stress test mean? Stress test mean that they actually get you to do some exercise, and they hook the machine onto your body and monitor while you exercise. Remember, when you suffer from angina, that is when you exercise, one of the trigger. And emotional. Of course, the doctor won't upset you and make you angry and try to do the emotional stress exercise, right? The easier way to do is without harming you, like they ask you to do the exercise. Go for a run. Treadmill is the common one. Run on the treadmill for a certain time, increase the intensity, then as well as hook up the machine on the body. And while you run during the stress test, hook up the machine and monitor your heartbeat and your breathing while you exercise. So this type of test can determine if physical activity triggers your symptom. Again, if physical doesn't trigger, it may be emotional. It may doesn't trigger at all. And this is another further one, right? In some cases, but again, in this stress, like physical activity stress test, it won't do it on the elderly patient. If they are 80 years old, 70 years old, they are not running, they can't run. Now my patient, I've asked them, have you done this? Have you done this? No, I haven't. The doctor didn't ask me to do that. They only put 24-hour electrocardiogram. So more for like 40 years old, 50 years old, you still physical running. For those, they have no strength in the leg. There's no point to ask them to run, because normally when they get chest pain, they are not exercise. They are not getting the chest pain while exercise. They are sitting there and getting the chest pain. So there is no point for asking 80 years old and 60 years old, 90 years old to do a stress test on treadmill, right? So this test is mainly for those people 40 years old, 50 years old, 60 years old, something like that, and or anyone that they are still physical fit, and the pain that they suffer from, and that will lead to exercise. Therefore, doctor will ask you to do that. Okay. Now, in Chinese medicine, we apart from asking medical history, collect the medical history to understand the chest pain, and we actually take the pulse. So take the pulse. Why taking the pulse? Because the pulse can tell what organs are out of balance. Now we can check your heart pulse, and we look at the tongue, because tongue over here, it can tell whether you have heart problem or not, or the tongue should be flat in the front, but it have a narrow or bumpy up, that we know there's a heart problem, right? Because the chest pain in angina that happen, chest pain, it can come from stomach, right? Excuse me. It come from stomach, and so in Chinese medicine, we take the pulse, look at the tongue, and combine the pulse and tongue or your face. I look at the ear. If you have a crease in the ear, and that's a heart problem. Okay. Now, if you have like crease between the eyes, there's a heart problem. Or the color change between the eye, there's a heart problem. That indicate heart. So the crease over here and the crease over here, heart issues. If see people do this, yeah, this is the crease. Without doing this, they still have the crease. You have to warn them, be careful of the heart problem, heart attack, angina. They will have it. Oh, you look at the color change. So this is by look at the face. This part indicate heart issues. That's what I mentioned about. We're going to talk about some diagnosis in Chinese medicine. So simple. Okay, so standing the outside of the house, how well is this family doing. Stand in front of a patient by looking, this patient health, whether it's good or not. But it doesn't mean you want to talk about it, because not everyone will accept that. So if you're an acupuncturist, learn all those things will help you to diagnose. When patient walk in, you know what's going on. Okay. Now, in some cases, your doctor might run a blood test to measure your cholesterol and see reactive protein. C-reactive protein is called CRP. Okay, high level of CRP can increase your risk of developing heart disease. What does CRP mean? Any of you know CRP mean? So CRP is C-reactive protein. It's a substance produced by the liver. What is the function? It actually responds to inflammation. So if the CRP level is high in the blood, this is telling that there's a marker of inflammation. Well, it can cause a wide variety of conditions, from infection to cancer. So it's not really a thing that can tell that, hey, this is blah, 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 this is blah, blah, blah. No. It's just a test to tell that you have inflammation in your body. So by measuring this, when you treat something, when you just treat one thing, and this thing getting better and the CRP is getting better, that indicate that it's this disease that causing the CRP high. If this thing's getting better, but the CRP is still there, still quite high, it means that you have other disease that causing the CRP high. The other disease that is actually causing the inflammation, not just the heart problem, or not just not related to the heart, something like that. Okay, I hope this makes sense to you. Right, the CRP. The CRP is not things that when it's high and it directly said, oh, hey, you have stable angina. No, it's not that way. Okay, but we will still treat it. It can be high. Okay, it can. It indicate that if CRP is high, that it increase your risk to of developing heart disease. Okay, I hope this all helped. All right, today is actually Wednesday morning. So tomorrow is Thursday. I'm going for, we have a family trip tomorrow. So we're gonna leave at about 7:30, like, you know, and now it's 7:42. So we're gonna live here in 7:30, which means I won't be able to do a live video tomorrow morning. So I'm so sorry about that. We're gonna head, you know, 3 hour drive to the Snow Mountain, uh, from where we live, Hamilton. So I don't think I'll be able to do a live video tomorrow, and for the rest of the a week until next Tuesday. So we may just stop for about a week, and then we carry on. But I'm going to film some videos. So I'm gonna to put some vlog instead. Hopefully I have time and do all this. I'm gonna film a lot of things, and hopefully I have time to edit some video and put it up for everyone. Okay. I think that's it for today, and thank you for all your supporting and all your time and being here with me, and let me share my knowledge with you. Okay, I hope this all help. And I actually have been filming some video, but it's in Chinese, to look at the face to help to diagnose. It's an easy way. You look at the face, but a lot of people wear makeup, so it won't be. You may not see. Um, you may not diagnose using your face. Diagnose your patient all the time. If someone wear makeup, you can't see it. You can't tell. Okay, but there are a lot of people that don't wear makeup, so you can still tell what's going on with their health. Okay. And the video, a few of the video has been up in Chinese, in Chinese, and I just need to take time to go through it in English. Okay, but yeah, too busy, too many tasks, and yeah, something like that. Right, stay awesome, and I love you all. I'll see you tomorrow. Not tomorrow, next week probably. Bye bye. Still there.